Sorry for the slight delay. Link issues. And so looks like we have a quorum, right? Morgan, Greg. Ooh, do we have a quorum? We don't have a quorum yet. I suspect the link.
We have a quorum.
We do.
Greg.
Oh, we do?
Brooke and Landry are here also.
Oh, sorry. Need to turn on my.
And hey guys, Lindy's on as well.
Hi,
Okay,
Lindy.
good.
Great.
All right, then I will go ahead and. Okay, good evening, everybody. This is the regular board meeting of the Boulder County Board of Health. And it is now 5:35 on Monday, May 9th, 2022. All board members, please announce yourselves. This is Greg Thomas, Board President.
This is Morgan McMillan, Board Vice President.
Brooke Harrison, board member.
Lindy Hinman, board member.
Okay. And we'll see if Landry gets on, but we do have a quorum. So this regular meeting of the Boulder County Board of Health has been called to order. A discussion of Boulder County Public Health Executive Director Camille Rodriguez. Notice of this meeting was posted on the Board of Health's website as required by law and included the teleconference Zoom phone number and conference ID. We are still doing these meetings virtually, and we'll be looking at a date in the near future to kind of get back to hybrid, but also in person. So with that,
Landry, I'm here, just so you know.
hi Landry.
Okay.
All right. And so with that on the agenda, we have. Not with it today. 4 hours of sleep. I'll apologize. Just have all this stuff open.
Let me know if I can be helpful, Greg.
All right, first item up, looks like we have public comment on unscheduled agenda items. And I believe we have one person signed up for public comment.
Yes, we have one person. I'm going to submit them as a panelist right now so they can come on. So give me 1 second. We have Brian Scott. He had requested to make public comment. You have 3 minutes and it starts now.
Hi, this is Ryan. Can you hear me?
Yes.
Super. Thank you for letting me speak here. I just wanted to submit some observations from kind of tracking what you've done over COVID. I think your reactions and actions throughout the community. I've been in Boulder my entire life. I own a company here, and I found all of your actions to be somewhat despicable over the course of COVID, which was unfortunate. You vilified a particular group, which you chose to vilify unvaccinated people. You did this through weaponizing your statistics and internal panels and this and that. I think you did a very, very poor job of building up trust within the community for these choices. Again, you were alienating folks throughout. You endlessly draw this COVID charade on and on. You aren't meeting your community members in person. That's very unfortunate. And I think all of you deserve to get from behind the laptop and come meet folks face to face. You're the last holdout here, which is unfortunate. But I've been tracking a lot of your information. Your average age of death, as you presented it during your last meeting, was 72 years old and 86 years old. And for you to continually press vaccination among kids is laughable, and it's not good as a health organization. they're at zero risk, near zero risk of COVID. Therefore, why do they need this vaccine? And your inability to explain those things away is truly sad. You continue to prop up with case numbers. I was glad to see your testing was down 17.2%. People are very fatigued on that. And I just think it's a shame. I think you're hiding behind your computers. I think you're very disconnected with the community at large. And just know that February meeting where you had 100% dissension between the folks that spoke up, I think that was very telling. You guys will continue to whip cases in the background here, but your community is very, very tired of this endlessly drawing on, pretending like kids are at any notable risk of anything, long COVID. Back it up with numbers. Don't just say these things. So all these, the way you're tackling things, very disorganized, not very good. I think you can do better. I know I need to work with you folks. And there's people in your community that want to meet you in person. They don't want to do it via computer.
30 seconds left.
Yeah, I think it's unfortunate that you're unable to reconcile this cognitive dissonance of how did these places get by without masks, without vaccines, excess mortality in countries that are highly vaccinated. You don't touch on that, try and explain it away. But I think if you were to dive deeper into that, it might open you up to some new ideas. I see you have a new board member, but anyways, I think you guys can do better and certainly look forward to tracking what you do moving forward here. But your predatory moves were not appreciated. Thanks.
That's time.
Okay, item 2 on the agenda. Let's see here. That would be approval of the minutes of the April 11th, 2022 board meeting.
This is
Any
Morgan. I
items
move to
call?
approve the April 11th, 2022 regular meeting minutes.
This is
is
Landry,
Brooke.
a second.
Okay, motion and a second. All in favor? Aye.
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 All right, item 3, staffing announcement.
Sorry, couldn't use my mute button. President Thomas, if I may, this is Camille. Welcome, President and the Board of Health to this May meeting. I wanted to introduce you to Boulder County Public Health's new Chief Medical Officer, Dr. Bob Bellnap. He is here with us this evening. Of course, I shared with you why Dr. Bellnap is joining our team. We're very pleased to have him. I know that we worked so well with Dr. Michelle Haas, and for various reasons, especially obligations towards her work at Denver Health in tuberculosis clinic management, it was clear that priorities had to take place relative to her work there. Dr. Bellnap and Dr. Haas are both a part of the contract approved by the Board of Health. And so it seemed fitting to have Dr. Bellnap join us. He also serves another local health department near us, and I can have him explain. But as I mentioned to you in some correspondence, Dr. Bellnap is a specialist in public health, infectious diseases, and internal medicine. And so I think it's only fitting that I turn it over to Dr. Bellnap just to say a few words and greet you. And hopefully he'll be able to stay on this evening in case you have questions about our COVID-19 update. Dr. Bellnap, I'll turn it over to you.
Yeah, thanks, Camille, and nice to meet everyone. As she said, my name is Bob Bellnap. I am an internal medicine and infectious disease specialist. I've been in Colorado since 1998 and at Denver Health since 2005. I've been the medical director for the tuberculosis program for actually the last 9 years, and the tuberculosis program serves Boulder County as well as the other 6 counties that make up Metro Denver. So I've known several folks at Boulder County Public Health for a long time and worked closely, and I know and have known Chris Urbina, who was your medical director prior to us taking this on in the fall. So as Camille mentioned, Michelle Haas really enjoyed working with the health department, but other commitments and obligations just made it impossible for her to continue. So I was happy to step into this role. I've been serving as the chief medical officer for Broomfield County as well. And so a lot of synergies and collaborations that are already existed. So that's a bit about my background, and I'll be able to stay for the whole meeting. So happy to answer any questions now or questions that come up later.
Thank you, Dr. Bellnap. That was really the extent, President Thomas. I wanted you all to meet Dr. Bellnap and have an opportunity to interact with him a bit in this space, but I know that you and the board were aware of this change, and so thank you for this opportunity to announce the staffing change. That concludes my portion, unless the board has questions.
Okay, welcome, Dr. Bellnap. All right, item 4 on the agenda is 2022 budget amendment.
Thank you, President Thomas. I am happy to introduce our Director of Administration and Finance, Catherine Palmer. Ms. Palmer is here to present a budget amendment to the Board of Health and to submit it for your vote of approval. Should it please you after you hear Ms. Palmer's presentation and ask any questions of her. So I'll turn it over to Catherine at this time. Thank you.
Thanks, Camille. Good evening. As Camille stated, I am Catherine Palmer. I am the new Director of Finance and Administration. I started in January of this year. Tonight, we are putting forth Resolution 2022-01, which was included in the meeting packet to amend the Boulder County Public Health 2022 budget and adjust for the budgetary needs within the health programs. So this presentation will provide a breakdown of Resolution 2022-01 for the amended budget. Specifically, we will review the amended budget request by looking at the changes between budgetary figures from the initially adopted 2022 budget, which was presented in July of 2021, into our current budget state as of April 2022. We'll also take a look at details behind the amendment, including FTE comparison, unfunded budget requests or UBRs from our programs, and the comparison status of our fund balance. Finally, we will identify considerations for the upcoming 2023 budget, as well as any estimated process and timeline. Okay, so on this first slide, we are listing out the expenditure revenue changes to our general fund that was originally presented to you in July of 2021, and then where we are now in April 2022. As you can see, the overarching change in general fund will amend our budget by a little over $1 million. Please note the shift in our state funding going down slightly while our federal funding increased, which does align with changes in ARPA and COVID funding. And finally, due to this, we did see the reserve funding amount we plan to utilize to balance the budget go down slightly. Next, we'll go into a little more detail behind these numbers. So we had 3 big areas that impacted our FTE numbers. The largest area of fluctuation that occurred from the July 2021 over to the April 2022 is that we moved 17 individuals that we had on board with us through a staffing contract with Insight Global into FTEs. Our figures for our special projects FTEs did not adjust exactly as we expected, though we did see it go down due to attrition. which was around case investigators and tracers. And we do expect this to continue to go down through 2022. And then finally, due to grants received in 2021, we were able to hire additional needed staff in different programs. So next we'll go over the 2022 unfunded budget requests, or UBRs. This year we had $640,405 in unfunded budget requests come in from programs or were rollovers from projects we wanted to complete that were not ARPA eligible. There are some items on here I want to highlight. So many of these UBRs derive from grants, which ended in June, that covered portions of salary, as well as seeing an increased engagement from the community and other entities to start up previous projects that had been on hold. During our conversation around UBRs, we identified the need to increase our staff growth and development focus after limited ability to attend trainings and conferences. So we allotted $60K across programs in the department. And then as we start to open up our facilities again, we have put aside some funding to plan for potential facility updates and needs. And finally, as we prep for the community health assessment, or the CHA, we have close to $100K in one-time needs to be able to assist this process. So next, this is a very detailed sheet, but we'll highlight some specific areas to draw your attention to. Again, we are listing in this slide the fund balance projections as compared to what was presented to you in July of 2021 and where we were as of April of 2022. The first item I want to highlight to you is our fund balance went up due to increase in revenue areas, though we did on the flip side see a slight deficiency occur in our expenditures. In terms of our excess and deferred, restricted, and committed non-spendable amounts residing in our fund balance, we have a little over $1 million in those buckets combined. Next, we apply our committed funds that derive from 2021 to 2022 rollovers, the UBR amount, and the assigned amount to balance the 2022 budget, and we come to $2.1 million. This moves our available fund balance to just shy of $2.5 million and provides a slight increase from the projection in July of 2021. And this also leaves our fund balance at a slightly higher percent of 9.6. Just as a reminder, per state statute, the department must retain a minimum of 5% fund balance. So with that, this timeline projected here identifies where we are in the annual budgeting schedule. So in May, we present the amended budget to you. In conjunction with the amended budget being presented, programs within BCPH are beginning to work on their 2023 budgets. We have not received the county timeline yet, though the shifted schedule from last year will continue to be utilized with the goal to complete the budget work session in July and then bring the budget resolution to the board for adoption in August. In 2023, some of the considerations that we have for our budget, we do expect to see an ebb and flow in our revenue sources, namely our per capita funding that we receive from the state has increased by roughly 70%. And we continue to see ARPA funding come in. On the flip side, we do see some of our state and local grants decreasing slightly. Financial impacts from the wildfires also have yet to be fully seen, though we do expect to garner a better understanding of these by the end of the year. And with that, that wraps up the presentation. So do you have any further questions for me before we move for a vote? Morgan.
Thanks, Catherine, for that presentation, really helpful. I have a question about staffing. So I know Boulder County Public Health has had some turnover in our staffing, during the pandemic, and it sounds like we moved some contractors into FTEs, but can you speak, I don't know, Catherine, if this is a question for you or for Camille, about where we are in our staffing, where we hope to be, and sort of what positions are still, I know there's a couple of big positions that are outstanding. So where are we in that, and any updates would be helpful.
I'll start to respond, and then if Camille or anybody else wants to join in. So we are filling quite a few of our positions, but we're also looking at how we want to structure our department with the decrease that we're seeing in COVID. And because we had to build up so much in terms of our staffing to be able to respond, we need to now go back and identify what is the structuring need that we need going forward. Within that, we also have some requirements that are being asked of us by the state to also acknowledge our structure and how we'll be prepared in future situations if something like a pandemic or other type of emergency were to occur, what we would need to do to our structure to be more prepared. So I don't know the history behind some of the positions you may be speaking to, Morgan, but maybe Camille can fill in on those.
Thank you, Catherine. And yes, Member McMillan, Vice President McMillan, there are several key positions that are vacant. For example, in our strategic initiatives branch, we are actively recruiting for our mental behavioral health coordinator position. We have a couple of health planner positions, including the manager position open. We have certainly, like many other county departments and many other employers in this state, we've seen many staff resign and take positions elsewhere. We're actively recruiting. It is certainly a challenge because people are looking for positions sometimes out of public health, perhaps due to burnout, but we are remaining hopeful and positive that our recruitment efforts will bring the right folks into these positions. It should be noted that Ms. Palmer is keeping track of our full-time employee sort of roster and any of the savings that we are seeing because of these vacancies, and we will be presenting that in more detail when we do our budget work session this summer. But know that our teams, the leadership here at Boulder County Public Health, is actively recruiting for many positions. And so the outlook is positive, but it's moving a little slower than we all hoped. But that's sort of a very high level update on some of those positions that I think you might be thinking of. If you'd like to know about a specific position that I did not mention, please do ask.
Brooke?
Thanks. No, that's helpful. There was a few of them referenced in the director's report also that are sort of key positions. So again, it's nice to hear an update, and it's good to hear that we're actively recruiting and just thinking about how we prioritize some of those positions and get folks into the department.
Well, and if I may add, for example, our health equity coordinator position, that position we left vacant intentionally because I think you might have seen in the director's report that we're doing a refresh, and it only seemed proper to continue the conversations about health and racial equity in the organization, but think through and get recommendations from staff relative to filling that position and make it very thoughtful, and also coordinate with any of the efforts that the county is doing in the racial equity space. So that's just one example of where a very key position that's very important to our mission and vision and to programmatic operations, we intentionalized its vacancy so that we could properly fill it with the right type of position when the time was right.
Brooke?
The state funding decrease, do you know the reasoning behind that? Was that across the state, just generally for all public health departments? And also, since it has went down, does that have any implications for our funding anticipated for next year from the state?
Thanks for your question. So it kind of depends on which program you're looking on. So some of the grants that we have that we received from the state did go down, and that was the same across the board in other LPHAs. In conjunction with that, like I stated in the presentation, our per capita is expected to go up. So we have received that for the 2023 fiscal year. So typically in that area, we receive about 450,000, and this year we received 805,000. So it did go up a decent percent. So we will continue to see these ebbs and flows with the state but it is typically across the board in our, for the state in all programs with other LPHAs rather than just within Boulder County.
Got it. Thank you.
So Camille, I'm guessing you participate in other, kind of countywide director meetings, and I'm just curious what folks in other agencies are experiencing regarding turnover and ability to hire.
You're correct, President. I do participate in director meetings with other county directors. And just anecdotally, without being able to pinpoint one department over another, many of the departments are experiencing departures and challenges in recruiting. And so I think we're not alone. I'll also add that other regional local public health departments are experiencing the same challenges. And we're actually in conversations about workforce surveys, not only to understand what the workforce salary structure is like, but additional and deeper conversations about employee satisfaction, about some additional congruencies that we could achieve perhaps in how we're classifying positions regionally, so that building a strong public health workforce, even if we lose someone to another agency, makes more sense that we're building sort of that strong public health capacity. So in all, public health is not alone in this sort of great resignation, and also in the challenges of filling the positions, because it has been, if you think on just all of the disasters that many county staff have responded to in recent years, and very recently, especially with the Marshall Fire, for example, it has, for lack of a better term in this moment, burnout from staff has become very real, and many are leaving positions of public service, unfortunately. Our goal is to make public service attractive and to build this sort of regional capacity, especially with our other local health department partners in the region. It's a continued conversation.
Okay, thanks for that, Camille. Any other questions on resolution 22-01? Okay, you know the drill.
So this is Morgan, and I will move to approve resolution 2022-01. Do you need more
Sure.
language than that?
It's a
Okay.
pretty long title, so it's the budget amendment. So, okay, we have a motion. Do we have a second?
I'll second the motion.
Okay, thank you. We have a motion and a second. Any last discussion? Seeing none, all in favor? Aye.
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 Motion carries. Thank you. Okay, let's see here. We've got item 5 now, which is a COVID-19 update.
Yes, thank you, President. Tonight, we have from our Communicable Disease and Emergency Management team, Carol Hellwig, here to present a brief COVID-19 update to the board. Carol, I'll turn it over to you now.
Thank you, Camille, and hello, everyone. I do have a nice short and sweet update for you with just a couple slides. So this first slide has our case rate and community transmission or community level based on the CDC community level tracking tool. And we are seeing that cases are trending upwards. They have been trending upwards for the past few weeks. I included a table there at the bottom where you can see how those cases have been increasing from 82 in around mid-April to now 194.97, which borderline medium is not an official CDC term, but they use low, medium, and high. But if this were your doctor talking about cholesterol, they would probably call it borderline medium as opposed to normal. So we could very possibly shift into the medium level on the CDC tracker. The CDC tracker is updated only once a week on Thursdays. So it could be that trends start to improve by then and it goes down and stays in the green. Or if the current case rates that we're seeing are sustained, we will most likely be in medium starting next week. When that happens, there is not a lot that changes when it comes to public health orders, but we do want the community to be aware that those case rates are increasing, and it's a good idea to activate those precautions that we're all familiar with. And it would impact corrections, so the jail and our shelters under the state public health order, they are required to implement masking as a precaution. And our healthcare facilities, they don't utilize the community transmission or the community level tracker. They go by transmission rates. So anytime we're above 100 per 100,000, hospitals are implementing their measures, but not under public health order, but under their own measures of safety. So we are messaging this out, and this is a different tool and a different shift. But really, thanks to our high vaccination rates and the increasing access to therapeutics that we're seeing continue to roll out, and supply continue to improve, although it's not perfect, it is in process of improving. But in general, we're not so much worried about overwhelming our healthcare system as just wanting still to prevent transmission in the community, because even if we're not overwhelming our healthcare system, there are still some unknowns, especially for long COVID. The CDC has launched a website on long COVID with information and details there, and that is science that is still evolving. But in general, yeah, those cases are trending upward, and it is a good time for both the community and our partners to implement those measures to make sure we don't get squarely into the medium, or if we do, we're going to need to make sure that folks are following those precautions.
Can I ask a quick question before we leave this slide?
Of course, yeah.
I think I'm still confused by how the new community level
Mhm.
is determined.
Oh, yeah.
Because I thought it was really based heavily on hospital capacity. So we're showing, though our cases are increasing, our bed percentage is staying the same, and our admits is actually lower.
Yeah.
So why would we bump up to medium then at that point? Because it looks like the community impact is still the same. We just have a higher case rate.
Yeah. So if you look at the table, and you'll see that there's on the left, those two rows. And so one of them says fewer than 200, and that means 200 per 100,000 weekly cases. And that next one is 200 or more. In the past, with the regular transmission levels, 100 was the cutoff before we were considered in high transmission. And now that's been doubled to account for therapeutics. Once we reach 200 and higher, that's when community transmission is a little more widespread, and especially when the vast majority of cases are likely, or of people who are infected are likely taking home tests and not necessarily PCR tests. Above 200 is where we're likely seeing that transmission being so widespread that it's necessary to stem that trend to get cases under control. So we want to implement some prevention measures so that we're getting that transmission under control and then not impacting our hospitals as much. Because really, if it gets out, it's going to impact us. And so the community tracker, it does go to the hospitalization. So we could be having fewer than 200 per 100,000 cases, but if our hospitals are impacted by themselves, we would go into that medium level. But if we do go into that 200 or higher, we also get automatically bumped into the medium, no matter where our hospitalizations are at. I hope that answered the question. And I also see Dr. Bellnap's hand up.
It did answer the question, but I can also, as somebody who doesn't see this constantly, a community member that doesn't see this constantly, I could see how they would be unlikely to be concerned by a bump up to medium. And it is a little misleading since the community levels are supposed to be so heavily based on current impact on hospitalizations. At least that's how it's described on the CDC website. So I can see how this is could add a lot of additional confusion when we're presenting this to the public.
Yeah, and at this time, all of Colorado is still green. And most of the United States, just the Northeast, has some pockets with medium and high transmission. And then there's some sporadic pockets across the US. And Dr. Bell, yeah, go ahead.
Yeah, thanks, Kurt. I agree with everything you said. The only thing I was going to add to that is that I think the rationale behind it is that we know hospitalizations and then deaths are always lag behind. And so we as we see, this has been true throughout the past 2 years, we see cases rise and then hospitalizations tend to follow usually a few weeks after that, and deaths are behind hospitalizations. And so I think that's the reason for the CDC having arranged this in this way. Your point is a good one about how challenging communication has been to this point and how to communicate this to the public. And then what that message is and who is going to change behavior based on a change from low to medium. Certainly some people will. I think there are people now, there are people now who are taking precautions, right? That are wearing masks and doing things to minimize based on their own personal risk or their risk tolerance. I think if there were a move to medium, there would be more people that would either resume wearing masks or limiting gathering sizes and other things. So it's like many of our metrics, it's imperfect, but that the reason to have that one be triggered before the hospitalizations is because of what we've seen with hospitalizations lagging behind case rates in the community.
Yeah. Yeah, go ahead, Morgan.
Thanks, Carl. Feel free to follow up on Dr. Bellnap if you had something else to.
Oh, I was just going to share that those communication messages for the general public when we're in medium are make sure you have access to testing, get up to date on your vaccinations, check with your provider if you have underlying medical conditions, and make a plan for getting access to therapeutics so that if you do get it, you can access those therapeutics to prevent a hospitalization. So those are the messages that we ramp up. It's not go put on a mask everywhere you go. It's masking only in those higher risk settings and masking for people who may be higher risk or people who have not access to vaccine. And nothing is mandatory except for mask in those high risk congregate settings like the jail and the shelters. Go ahead, Morgan.
That was my question, Carol. You answered it. Thank you.
Okay.
What was going to happen? What was the communication? And also just to remind those of us who are on the board, there is nothing that changes from an order. Nothing gets triggered. It's just a communication shift.
Yeah, the only thing in a state order is the corrections and shelters having to adopt masking when we're in medium. And we've already been in communication with our partners at the jail to let them know this is coming. It's a good idea to ramp up your precautions anyway, because with these case rates trending upward, you want to avoid your facilities being impacted. So, yeah, so great. So we can go to our next slide. Just a brief update on vaccinations and testing. We are planning for the vaccination rollout for the 0 to 4 age group. We don't have an exact time frame for when those vaccinations will become available. The current estimate is sometime around June. That's going to be coinciding most likely as we prepare for our back to school vaccinations as well. So we're making our preparations for the rollout of this new age group to coincide along with our efforts for back to school vaccinations, which will include boosters. And really those boosters are going to be critical for this fall, going into the fall, because we do anticipate a fall surge again this year as we did last year. So we're really going to have those efforts for vaccinations at that time, back to school time. And we're implementing focus groups for vaccine hesitant parents. At this time, they're still enrolling. It's still available for folks to enroll. It's 1 hour focus groups, and people are reimbursed, I believe, $40 for their time for participating. People have to be Boulder County residents and have children under the age of 18, I believe. Yeah, but there's going to be special ones for parents of children 0 to 4, and then the different age groups and different focus groups. And for testing, we continue to have daily testing available at Stasio, and we have weekly testing available in Nederland currently through the end of May. And if necessary, that may be extended, but at this time we know we're at least through the end of May. And otherwise, we're working on an endemic plan that would also have surge planning built into it. But that's everything in a nutshell. I'm happy to take any other questions. Yeah, Brooke.
For the focus groups for the vaccine hesitant parents, is that solely to focus on COVID, or is that for general vaccine hesitancy?
So Indira could speak better to this, because Indira was very involved in our past focus groups that we have had for vaccine hesitancy in general. And I know that focus groups we've had in the past on vaccine hesitancy have informed our future efforts, but I don't know the specific content of these focus groups. So if Indira's on, could share, or we could get back to you with that information. But we have done a lot of general hesitancy work as well. Oh, I see Indira popped on.
Yeah, thank you, Carol. So we have done, in 2016, we did a comprehensive focus group with vaccine hesitant parents, and we were able to determine kind of some of the root causes around vaccine hesitancy. So for example, one of the issues that came up during that time period was that OBGYNs typically did not talk to new mothers. And so the relationship that's formed between a new parent and the pediatrician doesn't happen until after the baby is born. So there was a lot of really great information that came out of those focus groups, which we helped to start, asking questions with our healthcare systems around, are you offering vaccine education during your birthing classes and things like that? So we have a lot of that rich information that was then confirmed by some of the state surveillance systems. They asked some very similar questions, and also the large Immunized Colorado as well. These focus groups are really specific to COVID. We know that we see a lot of disparities, particularly for the teens, for younger children. We do see some disparities, particularly by race and ethnicity, that we're concerned about. And so these are focus groups that are both in English and in Spanish. They are geographically diverse. They're being held in the mountain communities up in Nederland, also down in Longmont, and in Louisville or Lafayette. I believe they're going to do them in Lafayette. And then, and the goal is to be able to get information and glean information from vaccine hesitant parents as to what would make them feel further confident to move them along the continuum. We know that we have unique, population and community in Boulder. And so it's an opportunity for us to glean and hear from parents about what their concerns are. So we're doing separate focus groups for 0 to 4 or 6 months to 4. And then we're doing another separate group of focus groups for 5 to 11. And then the goal is with our contractor that we have is that we're going to actually bring parents back to test some messages. So the contractor is actually going to work on developing a vaccination communication campaign in participation with our comms team. So that way we can make sure that we have a good communication plan going into the fall.
Thanks, Indira. Any other questions about our COVID planning?
No, I mean, Carol, I know I saw some news headlines today about forecasts for the fall and winter, and it doesn't sound great. Hopefully that doesn't materialize, and we can get into endemic stage.
Hopefully vaccinations and therapeutics will keep us protected. Brooke, is that your hand up again?
Yes, I had one
Okay.
other quick question.
Oh,
So
of
for
course.
the endemic plan, do you all plan to share the highlights of that plan with us at some point?
Absolutely, absolutely. We're very much aligning with the governor's Colorado roadmap, ensuring that we have the capacity to respond to surges, ensuring therapeutics access and vaccination access, and the EPI has shifted a lot, so towards priority populations, and so we have plenty of capacity to work with those priority populations, and it'll be about having enough staff to be able to ramp up and down as necessary, and different activities that occur in different conditions. Yeah, but we will definitely share the endemic plan highlights or summary or the full endemic plan as soon as it's available, for sure.
Thank you.
Sure. Great. Well, thank you, everybody.
Thank you, Carol. And Indira. Is that it for our COVID-19 update?
Yes, it is.
Okay. All right, so now we'll move on to item 6, which is the Marshall and Middle Fork Fire Response.
Thank you, President Thomas. Tonight we have our Director of Environmental Health, Joe Malinowski, here to provide us with an update. Joe?
Good evening, board. First slide, thank you. Joe Malinowski, Environmental Health Division Manager. Just want to thank you for the opportunity to provide just a quick update on the wonderful work that the teams are doing on the recovery. Before I get started, I just want to take a second definitely to thank the air quality program led by Bill Hayes, and that team is just doing an outstanding job to continue to address those air quality issues. Erin Dodge and her water quality team to address some of the water quality issues out there. Our admin support staff who field all the calls we get every day. Our contractors who do the contractors to get the work done and get the paperwork done that we need to do to be able to do this work. And then also our communications team that just does a really outstanding job to communicate to the public. So thank you all for that. Like I've done in the past, I try to put pictures in here to try to show you what kind of where we're at in the recovery. And this time you can kind of see the original fire burn area where the house is burned. You can see in the next picture where we did some soil testing and air monitoring, and we have people in the area just really trying to gauge what the hazards look like there. And then we're in the cleanup stage in this third picture, and then ultimately we'll go to the rebuilding stage. And I would say we're right at the third picture where we're starting to remove debris. And once we get that out of there, they'll be able to rebuild. Next slide, please. So what I thought I'd do today was really try to center us on why we're doing all the work in environmental health that we're doing. whether it's on air quality or the water quality or the healthy home issues about keeping people safe, it really has to do with the hazards that are involved with that fire. And if you recall, it was either the first week of January, the second week of January, we came to the board and asked to pass a public health advisory. And what that advisory really did in conjunction with the fire was really declare that because of all the hazards out there, that there were hazardous wastes that were detrimental to the public's health, and that also those hazardous wastes need to be moved in a very timely manner. So again, all the work we've really done is really tried to address that hazardous waste and the public health implications around that. Next slide, please. So what I try to do is just put in some of the areas that we've reported on every month that we're working on. You know, the soil testing we did our own soil testing around the footprints of the home to really see the extent of the heavy metals and the asbestos. Boulder Valley School District did testing, surface testing, ground testing, look at whether their playgrounds and their sports fields, how impacted they were. And we were able to use that information to help provide guidance and then clean up guidance to help people, again, keep it safe for when people return to their schools or to their homes. We also use that same information to testing to help develop the debris cleanup testing protocol, which really established so as they clean up the homes and remove the debris, it requires they do testing to make sure they have removed the heavy metals and asbestos. And we also use that same information to provide some guidance like the gardening guidance, where people really want to know if I had ash and debris in my home, outside of my home, would it be safe to be gardening? So we provide guidance around that, working with the extension office. And then I think you're also aware that the air monitoring that's been done, we had NOAA and CDPHE doing both indoor testing and outdoor testing, looking for VOCs, and we really were able to establish the VOCs were the highest right after the fire and really dissipated, and aren't the biggest concern now. Our biggest concern again would be the blowing of hazardous waste. So to try to keep an eye on that, we put up those 26 monitors we reported on in the burn area. It allows people to go get text messages or email messages to let them know what the air quality is. I think we've had over 1,600 people subscribe to that. And I think we've pushed out over 2,000 messages so people can subscribe to the level of air monitoring notifications they get. So that's been really successful. And then the water quality, I think you're aware that we put the hydromulching cover down to really try to stabilize the waste to keep it from moving off site, whether during a rain or windstorms. And Purdue University came and did some testing on private well testing. And what they really showed, they did find some impacts for heavy metals, but we believe it wasn't related to the fire. So it really helped people that were on private wells knew what they need to do to recover. And then we also knew there was open water impacts where debris had blown into the open water. We work with municipalities, CDPHE, to make sure that we're addressing that so when the public water systems reopened, it was safe. So just some of the recovery assistance we've done, you know, part of what we do with the testing and just realizing there are hazards out there, we made PPE recommendations. If you recall, there was people out there working, sifting and those kind of things in the debris. And we really provided some guidance on, again, that proper PPE to make it as safe as possible. We also hired an industrial hygienist to help people navigate, the homeowners navigate insurance or cleaning up their home, and just had questions about perhaps a contractor they're working with. And he's really been successful working with a lot of the homeowners one-on-one. And then again, just the plethora of home cleanup guidance and that we've provided on the website, mostly from our communication folks. And what I thought I'd do, you know, when I look at this as it is all wrapped up to communication, I thought I would share with a video that we just completed that helps describe the VOC issues in the burn area.
I'm Bill Hayes, the Air Quality Coordinator at Boulder County Public Health. We've received many questions about volatile organic compounds, or VOCs. Public Health worked with our colleagues at the National Oceanic and Atmospheric Administration, as well as the Colorado Department of Public Health and Environment. Both agencies have mobile air monitoring vans equipped with an array of instruments that can collect samples for a wide range of gaseous pollutants, including VOCs. NOAA performed 2 drive-throughs and CDPHE 1. The highest levels of gaseous pollutants were recorded on the first pass and were comparable to typical urban air pollution. As expected, levels decreased with each successive drive. NOAA has agreed to perform 2 more drive-throughs once the county-led debris removal effort begins to ensure that the process doesn't liberate additional VOCs, though this is not expected. Many residents have purchased low-cost air monitors that can be helpful, but it is important to understand their limitation. Keep in mind that there is no assurance that any individual monitor has been properly configured, deployed, or maintained. One of the most popular manufacturers of low-cost air monitors recently offered an additional VOC sensor on their standard particulate monitor. The manufacturer cautions its customers that VOC sensor is still experimental and they do not feel confident enough yet in their VOC readings. You can now access real-time air quality information and sign up to receive alerts at boco.org/MarshallFireAQ. If you still have questions or need additional assistance related to air quality, please contact us.
So that video will go up on our web, and there's other videos that we're putting together that also help the public navigate returning to their home and the cleanup efforts, and some visuals to help them in this effort. So happy to take any questions. Thank you very much.
Nothing from me, Joe. Keep up the good work.
You're welcome. Okay, thanks again. Have a good evening.
Okay, you too. All righty. Now we are back to the agenda. Item 7, the director's report.
Thank you, President Thomas and Board of Health. I know hopefully you've had a chance to take a look at the director's report. One of the hardest things about submitting the director's report to you is exactly just what Joe Malinowski just displayed, that our staff do so many amazing things like make videos to further explain the VOCs to our community, and it's really hard to reflect that in the director's report. But it's definitely full of information about high-level initiatives like our Health Equity Coordinating Committee's refresh work. Hopefully, you've had a chance to dive into the legislative updates, and I know Jordan Thomas has been sending those to you. And more. So I will just say that lastly, as you noted in the report, I'm looking forward to retreating with our leadership team soon here in a couple of weeks to do some leadership work, building our team together in person, having discussions about strategic initiatives and more. So with that said, I'll take any questions or clarifications that you might have. Thank you.
No, I didn't have any questions, Camille.
Thank you.
Yeah, this is Lindy. The only question I had was related to some of the staffing concerns, and those were addressed earlier. So
Great.
Appreciated that. Yeah.
Thank you. Thank you.
Okay, well, it must have been a very efficient report, answered everybody's questions. Good
Great.
job.
Thanks.
Okay, and now old and new business, item 8 on the agenda. I don't think I have anything to report. Doesn't seem like everybody else does either. Okay, now we move on to item 9, and this was a addition for Monday. And so this is going to be on a request to vote for a vote of the board to approve 3 special meetings in May for executive sessions and we will list those when we make the motion. And so really the intent of these executive sessions is to discuss the staff survey results, that staff survey regarding input on the executive director's first 10 months of tenure, we received those results last week. And so now we want to kind of take the time to understand those results and then, figure out any next steps that need to come with that. But it's really just to give the board the opportunity to just really better understand them. And so talking through them is always best versus, something like email. So that's the intent of this. Okay, so we have we'll need to do a motion. So Morgan, would you mind taking this one?
Sure. So this is Morgan. I move to hold the following special meetings for the sole purpose of holding executive sessions pursuant to Colorado Revised Statutes 24-6-4024, Wednesday, May 11th, 2022 at noon pursuant to Colorado Revised Statutes 24-6-4024B, in order to receive legal advice on the board's duties and authority in employment matters and on the applicability of the Colorado Open Meetings Law with respect of various types of meetings and decision-making. Thursday, May 12th, 2022 at noon pursuant to Colorado Revised Statutes 24-6-4024F to discuss the Boulder County Public Health Executive Director's Performance Review. And Wednesday, May 18th, 2022 at 7 p.m. pursuant to Colorado Revised Statutes 24-6-4024F to discuss the Boulder County Public Health Director's Performance Review.
Okay, thank you, Morgan, for that motion. Do we have any questions from the board? Okay, we have a motion. Do we have a second?
This is Brooke, I second.
Okay, we have a motion and a second. Let's take that vote. So all in favor? Aye.
Aye.
Okay, so that motion carries. So one of the things, and this was brought up in I think in the March meeting when we had an executive session at that board meeting. So Camille, since you're the subject of the second and third executive sessions, do you want to request that either of those two meetings are open to the public?
I do not request
Okay.
such. Thank you.
Okay, that's great. Because these special meetings are for the purpose of holding executive sessions not open to the public, no call-in information or Zoom link will be available, and there will be no public comment. So I think that wraps up that item. And that brings us to adjournment. So we are adjourned. It is 6:37 p.m. and thank you everybody for your time. Thank you again, staff, for the great updates. And it's nice to really be on a kind of a good cadence now. Let's hope we keep those case numbers down and don't bump up into the medium. But anyway, we will revisit this again next month. Can I ask a clarification question? Sorry, on the upcoming agenda items. So is the August board meeting when we approve the budget?
President Thomas, to my recollection, we hold a budget work session with you, the board, in July. And then we tend to go back to the drawing board should you, at your pleasure, have staff reconfigure anything, rethink anything. And then I believe, but I will email the board with a confirmation as I look back at our history. I believe we bring you the recommended budget. This would be the FY23 for your vote in August. That's my recollection. I can definitely confirm after I look at our history.
Okay. Yeah, it'd be good. And we don't really need it until next meeting. But next meeting will be in June. And I know in years past, we've added a budget study session
Yes,
that is not part of the regular monthly meetings.
correct.
And that sometimes occurs in late June or early July. So I just want to make sure, so I'm, I've got a vacation scheduled, but I don't think it conflicts with the budget vote.
I think you bring up an excellent point, and know that Jordan, Thomas and I will work to doodle poll a budget work session that works for the board. We are still in very good alignment with the county's schedule, and Ms. Palmer and I now meet regularly with OFM to maintain those open lines of communication, so they're aware of our budget activities as well, and we're comporting with their schedule too. So we'll make sure that we get that doodle poll out to you all and make sure it works for everyone. Thank you.
All right. Thank you, everybody. Now,
Oh, sorry, Greg.
Morgan had a question.
Sorry, I had a quick question that I probably should have asked during the regular meeting, but in terms of when we're planning to go back in person,
yes,
and then related to Greg's question about vacation plans in summer and all of that, are we going to maintain the ability to do hybrid if we're not in town for an in-person meeting? Because prior to COVID, we were only doing it if we needed a quorum, but it would be great to have the option to be able to come remotely, even if we have a quorum, if we're out of town.
Absolutely. Excellent question. And if I may, I continue to work with our county partners relative to a hybrid space. One of the challenges has been, in a good way, they've gone through a lot of remodels downtown at the courthouse, and things are also not ready there. Supply chain issues and the like. I won't go into those details. And then there's the added question about using the downtown in the evenings like we need to, and added cost for us, public health, in hiring security and entrance into the building in a hybrid space. So with that said, we're still trying to get updates on making our spaces at the Boulder campus hybrid. And finally, to answer that particular question, we will ensure that we have the hybrid option so that the public and the board can participate in person or virtually, so that you have that option if you are on vacation to join. We think that that's important, but mostly also for the option that our public needs if they wish to provide public comment, that they could do so virtually if they choose. But you're important too, and then so are staff. I think it's a great way to look at the future of holding these meetings, and definitely I'll give the board more updates in my regular emails to you about the progress of the hybrid situation at either of those locations.
Okay, great. Thank you.
Great.
Good question.
Thank you.
All right. Thanks, everybody. Bye.
Thank you. Have a good night.
Bye all.
Thanks, everyone.